Hello, my topic is about treating adolescents and children experiencing chronic pain with psychotherapy interventions. So, 126 million patients report pain related complaints to their healthcare providers every year. 31.8% of those patients are children and adolescents. Chronic pain is defined as a continual and intermittent period of pain that occurs longer than 12 weeks. The effects of chronic pain not only disrupts the individual's daily living physically, but it also affects them emotionally and mentally. Treating children who experience chronic pain can be a complex task, especially when considering the added factors in a child's life, such as the academics and the ramifications with school life, such as attendance and extracurricular activities. The development of relationships and friends and classmates is also affected, and the psychological effects that can erupt from chronic pain, such as the feeling of worry, hopelessness, and sometimes even shame. Despite the overlapping effects of chronic pain being documented, there is a gap in treatment to cover the overall well being of a child. The research question at the center of this presentation is: can a child diagnosed with chronic pain benefit from psychotherapy as part of a comprehensive treatment plan? Research has shown that common complaints such as recurring headaches, unexplained abdominal pain, back pain, and unspecified general pain are symptoms often reported by children. Yet sometimes it takes 3 visits to doctors and anywhere from 1 year to 4 years and a half for a child to be referred to a pain specialist or even a pain clinic. That time frame is just to get to the pain specialist. By then, the depression and hopelessness and the feelings of it have begun to settle in, which is why it is imperative for psychotherapeutic methods such as cognitive behavior therapy and acceptance and commitment therapy to be a part of pain management treatment. The researcher hypothesized that pediatric patients will benefit from CBT because many of the exercises focus on increasing self awareness and decreasing pain and associated discomforts through the power of changing the thought process. ACT will support the CBT strategies by teaching children to develop resiliency to reach pain management goals in difficult times. Participants of the study will be referred from the pain clinic and or a pain specialist. Referred individuals will participate in a semi-structured clinical interview at the end of their initial pain clinic specialist consultation. The criteria for the referral to the study are as follows. Referral must be made from the pain clinic or pain specialist. The participant must be between the ages of 8 and 17. They must have documented pain less than 6 months, have documented history of previous failed treatments, and have documented challenges that are a direct result associated with the chronic pain. Participants that will be excluded are those with a secondary diagnosis that can be the cause of pain, such as other illnesses or other diagnoses. Participants that anticipate being in another study will not be eligible either for this particular study. And those that experience pain-free intermittent periods. The study will include 30 adolescent parent couples. The couples will be randomly assigned to 3 groups of 10 couples in each group. Group A will receive individual counseling implementing cognitive behavior therapy. Group B will receive individual counseling employed by ACT, which is the acceptance and commitment therapy. and Group C will receive pain management treatment without any psychotherapy interventions. Study participants will be surveyed at the beginning of the study, midpoint, and at the end of the 6-month study. Each time, information will be collected via semi-structured clinical interviews. The short version of the pediatric pain inference will be used. The PPI will be utilized because it will offer an understanding of behavioral actions that result from pain, as well as the impact experienced due to the pain. The PPI consists of 8 statements identifying academic, social, emotional limitations, and physical difficulties experienced due to chronic pain. Since research has demonstrated that parent participation leads to better outcomes, parents will be included into the study by their attendance to psychoeducational sessions and the completion of the parent version of the pediatric pain inference instrument. Parents will complete the parent version of the PPI to capture information that may be missed from the participant's perspective. The data that will be generated is ordinal because a Likert scale is used to record responses. The statistical test that will be used for analysis is a one-way ANOVA. The purpose of this test is to determine if the means are statistically different from each other. This test was selected because it is compatible with studies observing groups who have been randomly assigned and have 3 or more groups within the study. The results of this proposed research study will ultimately demonstrate the benefits of closing the healthcare collaboration gaps to treat children and adolescents effectively by treating the physical, the emotional, and the psychological symptoms caused by chronic pain. Thank you.